We'll be hearing from Kathy Kenyon.
I'm glad to be here. You have a long written statement from me for a couple of reasons. First, I have more to say than time. And second, I choke up when talking about this subject. So if we need to stop and move to questions, you have my written comments. My parents have been married for 65 years. They moved to live near me and my brother and our families in 2012, living first in independent living, and last weekend we moved them to assisted living, so I'm dealing with that right now. They have dementia, almost certainly Alzheimer's disease, which has robbed them of the ability to manage or plan, but they are otherwise healthy except for a couple of chronic issues. Mom struggles with hyponatremia, which affects the brain. It's low sodium, as well as fatigue and anxiety. For Dad, he has constipation and sleep apnea, as well as too much sleepiness during the day. Some of these are more concerned to healthcare professionals than others. For instance, I found that once we ruled out medication as either a cause or cure for fatigue, anxiety, and sleepiness, I'm managing those with Mom and Dad. The more serious medical issues, hyponatremia, constipation, and sleep apnea, are of concern to medical professionals and should be manageable. But my parents have made too many trips to the hospital because of complications of those. I've become an engaged caregiver in an effort to manage these conditions at home, which is what my parents want. My central point is that my parents' main challenge is living a meaningful life in the face of declining ability. Maintaining the best health possible is part of that. But what is most important to them, above all else, is being together and taking care of each other. Next is being near family and relationships that have meaning to them and that help them be who they are and have been. These relationships based on love, friendship, duty, are sustaining. Third, they want to live as independently with as much dignity as possible under the circumstances and under circumstances in which they clearly need help. In other words, they're trying to remain themselves with each other, surrounded by people they love. This must be nearly universal. I've come to think of myself as an existential family caregiver because it's my job to help them do that. What I have faced is a healthcare culture and the underlying incentives and systems that do not adequately help me as a family caregiver meet my parents' health and existential needs. What I want as I try to understand and manage my parents' healthcare conditions is informed advice that allows me to plan and help my parents live as well as they can according to their values. My experience, however, is healthcare professionals focus narrowly on clinical issues, which they can influence. In fact, they're trained to handle. I see two types of medical professionals who are not as helpful as they should be and are quite frustrating to work with. First, the doctor knows best type, who expect me to follow directions with little questioning or explanation, and who view my failure to do so as bad judgment on my part. Second, the specialist technocrat, who gives technical advice related to a diagnosis and potential treatments with little help in thinking through what this means for planning and life choices. And this has been especially a problem with dealing with the dementia experts. I have faced both of these types in trying situations. Both are frustrating. The people I'm dealing with are well-meaning. They are competent. They are working in a culture that is not serving either them, allowing them to be informed health givers, helping me, and they certainly aren't helping me. In my written statement, I share two inpatient and two outpatient examples of experiences with health care. By the way, the outpatient ones are far more important because that's who you deal with most of the time. But I think the culture is very much the same. They reflect a culture that fails to comprehend and help me in my task as an existential caregiver who has to deal with health as part of that. I'm going to focus on the awakening experience I had as a family caregiver related to a mom's stay in the intensive care unit in 2013 because of low sodium. This wasn't our first experience with this. Mom had fallen twice before and been hospitalized. So I knew about the problem. I had not been given help on how to manage it, I suspect in part because it can't be easily managed with medications. It requires attention to behaviors. But I also didn't demand that the physician help me as a way to monitor and manage it. What I did was I asked for labs, which I could not get directly. Most were buried in paper records and were not in the electronic patient portal, which meant they weren't available to me or other professional medical people. We identified Mom's decline in sodium because my nephew identified slur speech and unsteadiness, and so we got the labs drawn at the residence. I probably should have taken Mom directly to the emergency department, but I was at work, and I hate hospitals for my parents. When they're in the hospital, my parents are separated. The hospitals are disoriented. They don't get exercise. They don't sleep or eat. Hospitals are terrible places unless you really have to be there. So I hope to avoid the hospital. But the call with the lab results came in late at night. Mom's sodium was low enough to cause seizures and require treatment in the intensive care unit. So I took her to the emergency department. Fortunately, my nephew was able to stay with my father. It was very hard for me to get into it's an urban hospital here in town. Got no help getting in. Very painful, over 6 hours. My mom on an uncomfortable mattress. I had no place to doze. At 2 a.m., the nurse suggested I go home, completely unaware of how ridiculous it was to suggest I leave my 86-year-old mother alone in that room with dementia, anxiety, and sodium low enough to require time in an ICU. When they did finally find a bed in the ICU at about 6:30, I was asked to go to the waiting room. I told them I would stay out of the way but would not leave because Mom would be confused and afraid if I wasn't there, and they were also more likely to make mistakes. I stayed despite the nurse's consternation. All of the individuals I encountered were caring professionals, no doubt trying to do their best following hospital policy. They simply were clueless about the importance of my presence to my mother and clueless about the discomfort they put me and my mother through. Mom's sodium level improved over the time she was there. Technocratic specialists moved through, each with a slightly different opinion of the problem and the solution. So I asked for a hospitalist geriatrician who worked with our outside doctor. Mom was, of course, demanding to go home. She was tired of the unnecessary monitoring, the catheter, poor sleep, inability to move around. Dad, who had been getting there every day with help because he gets lost, was ready for Mom to come home. And I was looking for help on how to get them home. The geriatrician who showed up 2 hours late, by the way, I was starving. They were supposed to show up at 11:30. They showed up at 1:30. This is, so sleeplessness and starvation are problems family caregivers deal with. She said we should move to the regular hospital unit because Mom needed continued acute care. She didn't explain to me why we could not manage Mom's needs at home. Once I became convinced we could manage the fall risk and could get labs drawn regularly enough outside of the hospital, we took her home. In my written statement, you can see the email I got afterward from this geriatrician. Among other things, she said that since I unwisely acceded to my mother's desire to go home, despite the clear need for continued hospital care, I should hire a professional care manager who she assumed would make better decisions than I had. This physician was clearly not accustomed to her patients and family caregivers not taking her advice. She did not understand me as a daughter who understands and loves my mother and knows what we are capable of doing at home and understands what I'm trying to deal with in the broader picture. We took Mom home. I didn't get help on how you manage Mom at home. I had pretty much decided by that time that probably a regime of liquid restriction and salt tablets with constant monitoring of the sodium and watching Mom's behavior was what the best we could do. Mom got better at home. She was no longer a patient. She was back in her apartment, sleeping in her own pajamas with her husband of 65 years. She was much happier, and she was determined to follow a health regime that kept her at home because she knew that doctor wanted her back in that hospital. In the 16 months since that time, we've stabilized Mom, and she's not fallen. But I still can't get the labs directly in a timely way to manage the hyponatremia. I tried mightily after the hospitalization and including looking for home lab tests, which are technologically possible but not available on the market. It was the response from the geriatric team in trying to get the labs that I found particularly reflective of the cultural problem we have. And you have that statement, you have that in my statement. I was told that it was not advisable for me to get lab results because I would not be able to understand them. I took exception to that. And I think most of us who have dealt with long-term chronic conditions know what the labs are. You can look them up online. At this point, I still can't get the labs electronically. You can get them in 4 days.
Kathy, excuse me, 1 minute.
Okay, our current geriatrician texts me the lab results. And so when we've had a decline below 130, we were able to bring it up. The most common challenges I faced are difficulty getting the information I need to make informed decisions and manage health issues. The second is the unwillingness or inability, the cultural context, so that healthcare professionals don't accept risks that we take to keep my parents together and out of hospitals, and they don't really then help us manage those risks at home. Third, the failure to understand that central to my parents' health and well-being is the family. I should automatically be included in healthcare decision making. So family caregivers, I think, could be a tremendous resource to healthcare. We could have kept my parents out of the hospital. I have kept them out of the hospital. But that's less important than healthcare becoming more of a resource to my parents and me as they age into disability. They want the people they most trust and love, to be in their lives as caregivers. And that's what healthcare needs to do. Thank you.
Thank you so much. Thank you to all three of you.